Caring Unveiled with Jarrett Stull.
Welcome to Caring Unveiled, a quarterly program brought to you by Memorial Health Foundation. Today, we're highlighting a part of healthcare that most patients never see, but that impacts nearly every diagnosis, treatment plan, and healthcare decision: the laboratory. Memorial Health System's laboratory team works around the clock to provide testing and information that helps physicians deliver high-quality care throughout our region. Joining me today is Lindy Lemley, Director of Laboratory Services. We'll talk about the important role the lab plays in patient care and the people behind the work. Lindy, thank you for joining us today.
Yeah, thank you for having me. I'm excited to be here.
Well, let's start by you telling viewers a little bit about yourself and how long you've been part of Memorial Health System.
Sure. So I actually started my career here in 2002 as a student and just stayed in the laboratory for about 10 years. I was working at the MMH laboratory, and then I was actually the supervisor of the very first Belbury campus laboratory. So that was really exciting when that came to that area. And I left for a little bit. I was a teacher at the local college in the MLT program. Mm-hmm. And then I came back about 4 years ago in my current role as the Director of Laboratory Services.
Well, you've really seen a lot of changes in laboratory services throughout our health system.
There's been a lot of changes and a lot of growth over the years.
Well, I think most people probably have had some sort of lab work done, a blood draw, and then they leave and then they get the results later, but they don't know what happens in between. Can you tell us a little bit about the behind the scenes
Sure.
lab and what happens from that point?
Sure. That's a really good question because I think people are used to having their specimens collected, blood draws and things like that at our outpatient centers, but they probably don't think about what happens to it after the fact. So we actually have 5 full-service laboratories in our health system that are operational 24/7, 365 days a year to serve our patients. After your specimens are collected, they are transported to the laboratory, and then we do all of the testing and provide results to your providers and your physicians to be able to make decisions.
And everything's done right here within the health systems. It's not shipped outside the health system.
Yeah, we have a very broad test menu in our laboratories here. There are some specialty testing that we do use reference laboratories for, but the majority of our testing is done right here.
Yeah. And you said 5 labs throughout our health system that operate continuously, 365 days.
Continuously, never shut down, always serving our patients. Yeah.
That is impressive. I want to talk a little bit about the team behind that, talking about how many labs you have. That would seem to take a lot of team members and that have to have a lot of expertise to do this kind of work. Do you want to talk some about I know you're very proud of your team.
Oh, yeah, for sure. Yeah, we actually have close to 150 team members in our 5 laboratories, and we have phlebotomists, MLTs, MLSs, cytologists, histotechs, path assistants, laboratory assistants. So there's a very wide variety of people working in our laboratories. The folks that are actually performing the testing are professionals that have gone through either an associate or bachelor degree program in laboratory medicine. So there's a lot of expertise behind the scenes there, and they care a lot about what they're doing.
And I know there's a lot of equipment there, just having walked by and kind of peeked in. I know our viewers are going to see some footage of what the labs look like inside, but
yeah.
Do you want to talk a little bit about some of that equipment that they may see and what's really happening?
Yeah, sure. Everybody thinks we're in there just pushing buttons, right? So we have a lot of automation in our laboratories, which is wonderful because we can send a very large quantity of specimens through to support all of our patients and providers. But, there's some expertise there that you have to maintain the instrumentation and be able to troubleshoot, do quality control checks and calibrations to keep everything running. And our techs are really good at recognizing when things don't make sense. So they will kind of work through that and, be able to troubleshoot and understand maybe what's going on if we need a recollection or something like that. So the instrumentation is amazing, but the techs are really the brains behind the operation.
So listening to you, I think of it as very simple that I get my blood draw and then I find out the results, but not knowing what's, all the equipment that the hospital has to have and 150 people to do this work for our entire community
Right.
is quite impressive. But I know a lot of times we think, our providers, our nurses, they're the ones that's helping us make decisions about our healthcare. But a lot of those decisions are based on the testing that's done in the lab. Can you talk about a little bit why the lab is so important in that regard?
Sure. There's actually a statistic that 70% of medical decisions that your providers make are based on laboratory results. So it's very objectional data. It helps them to determine a diagnosis and how to treat and move forward. Monitor medications, make sure you're on the correct antibiotics for infections. The list goes on with the information that the laboratory provides.
Which kind of talks about why you need so many people in the labs, because we need those results quickly. To help us along our health journey.
Yeah, I'm really proud of our turnaround times. Even routine outpatient testing is generally done for sure within the first 24 hours and usually within the first 4 to 6 hours that it's at our locations.
Oh, I know. I see it very quickly in my chart. Often before I get a call from my doctor or anyone that I'm seeing it there, and sometimes often the same day that I'm seeing the results. So it's impressive. Well, Lindy, thank you for joining us. Thanks for sharing a little bit behind the scenes of laboratory services and what goes on there. I don't think that this is something we all think of as part of healthcare, but something that's obviously very important. If the statistics, 70% of helping our care is based on the diagnostics. So we appreciate it.
Well, thank you very much. I'm excited to talk about lab. I'll always do it.
Thank you.
Thanks
for joining us and for sharing more about the important work happening in our lab every day. While most patients never see what happens behind the scenes, our laboratory service team plays a critical role in helping providers diagnose, treat, and care for patients throughout our health system. And thank you to our viewers for your continued support of Memorial Health Foundation. Be sure to watch for the next edition of Caring Unveiled. Until next time, thank you for being a part of our mission.